Good morning, and thanks for waking up with us. On this episode, we are sharing information on stroke recognition and awareness. A stroke is a sudden disruption of blood flow to the brain and is caused either by a blockage of the blood vessel, such as a blood clot or plaque, or a ruptured blood vessel called an aneurysm. Blood carries oxygen and glucose to the brain, and without this, the tissue of the brain starts to die. A TIA, or transient ischemic attack, is a temporary blockage of blood flow to the brain and can produce symptoms exactly like that of a stroke. Often, a TIA lasts only a few minutes and luckily does not cause any permanent damage to the brain. A TIA is a serious warning though, and the American Stroke Association reports that 9 to 17% of patients who have a TIA have a true stroke within 3 months. If you experience stroke-like symptoms for any length of time, it is critical that you seek medical attention right away.
Identification of stroke, whether at home or in the hospital, is extremely important for various reasons. First, during an acute stroke episode, 2 million brain cells, called neurons, can potentially die each minute. Second reason is some patients are candidates for a special clot-busting medication called TPA. TPA can only be administered if the stroke is recognized early and the patient arrives to the hospital before 3 to 4 hours. Surgical intervention is another treatment option for strokes. However, it can be done only if a stroke is recognized and the patient is sent to a specialized hospital before 18 to 24 hours of symptom onset. Both TPA and surgical intervention save brain tissue, which can then reduce disability from stroke. So the sooner a stroke is recognized, the more brain tissue we can save, which can make an immense difference in the recovery and quality of life for the patient. These services include care after the clot-busting medication is administered at Wilson or surgical intervention at Miami Valley Hospital.
An easy way to remember stroke-like symptoms is a mnemonic called Be Fast. B is for balance. If you notice you or a loved one has had difficulty with balance, if you feel like you can't walk straight, if you feel like there's not good coordination, if you're dizzy, these symptoms are concerning for a possible stroke. E is for eyes. If you notice any change in vision, loss of vision in one or both eyes, this is important to recognize as this may be a sign of a stroke. F is for face. Most people are familiar with this one. If you notice that you or your loved one has an uneven smile, a facial droop, this is concerning as this may be a cause of a stroke. A is for arm or leg. If you notice that there's weakness on one side of the body that's different from the other side, this too may be a sign of a stroke. S is for speech. If you have difficulty finding your words, difficulty with the way your words are coming out, or slurring of words, this too may be a sign of a stroke. And finally, T is for time. It is imperative that you call 911 immediately if you notice any signs or symptoms of stroke. What can you do if you're having any signs or symptoms of a stroke? Call 911. Let them know that there are concerns for a stroke. They will activate the appropriate system so that we can timely and effectively treat your symptoms when you arrive to the hospital. Don't wait. Call 911. Do not drive yourself to the hospital. Do not call your family physician. Call 911 so they can get you to the hospital as quick as possible. Thank you for watching this episode of Wake Up with Wilson. I hope today you have learned that stroke is a true emergency and time is essential. At Wilson Health, we are here for you today and always.